Good afternoon, everyone. Good afternoon, everyone. Thank you so much for everyone joining us today. Thank you, Governor Moore. Thank you, Lieutenant Governor Miller. And thank you to Dr. Gupta for joining us today and to all of our federal partners for your tremendous support. It is my great honor to stand beside you today to help share the Moore-Miller administration's vision for reducing overdoses in Maryland and saving lives. So many of us, too many of us, have been directly affected by this crisis, whether we've lost a friend or a loved one to overdose, or we know someone who is thriving in recovery. We all have a stake in this, and we all have a role to play in helping to bring an end to this crisis. The path toward creating a Maryland where anyone struggling with substance use can get help whenever they need it starts by ensuring we are collaborating effectively and working toward achieving common goals. We need everyone working together on this issue because substance use and overdose affects all communities. In Maryland, we're working to address the overdose crisis from all angles. Maryland's newly named Office of Overdose Response is currently coordinating the development of an interagency coordination plan that will help guide our overdose crisis response efforts into the future. This involves convening a wide variety of stakeholders from state and local agencies to identify programs that can prevent overdoses and expand access to substance use care. We are engaging with subject matter experts from the research community and representatives of community organizations that are working hard every day to provide services to people who use drugs. We are also engaging with individuals with lived experience and community members who have seen this crisis firsthand. Our plan will focus on addressing the overdose crisis holistically across 5 comprehensive pillars. They are prevention, harm reduction, treatment, recovery, and public safety. Prevention strategies, such as those that help educate young people in and outside of school, seek to deter current and future substance use. They empower individuals by giving them the tools they need to navigate an increasingly complex world where potent substances like fentanyl can make drug use extremely dangerous. Our next priority is harm reduction, which focuses on meeting people where they are at without any judgment. Harm reduction efforts improve our chances to make connections to care by fostering and maintaining relationships with people who use drugs. Harm reduction gives people tools to prevent overdose, reduce the spread of infectious diseases, and improve their physical, mental, and social well-being. Next up, we have treatment. There is no one-size-fits-all approach to substance use treatment. Treatment services work best when tailored to individual needs. All Marylanders deserve access to treatment whenever they might be in their lives, and we are working hard to increase avenues to care. Our next focus area is recovery. Comprehensive recovery services help support the health and wellness of individuals following periods of active substance use or treatment. Substance use disorder is a chronic, relapsing health condition, and recovery efforts can help reduce the risk of relapse and overdose by addressing a person's fundamental needs, such as housing support, transportation, and meaningful employment opportunities. Lastly, we have public safety. Public safety officials, such as police officers or fire and EMS, are often the first to come in contact with individuals who use drugs or individuals in crisis. They can also help to create pathways to care that avoid criminal justice involvement, such as through law enforcement assisted diversion, or LEAD, which gives individuals the option to seek substance use care as an alternative to arrest. Public safety officials can also help expand access to care for individuals who are already involved in the criminal justice system, for example, by offering substance use treatment and recovery services in detention facilities. Taken together, we are confident that coordinating actions in these areas can help make a difference in the lives of those with substance use disorders. And while Maryland has made significant progress in building a robust overdose crisis response framework, there is much work left to be done. Everyone's voice matters in this process, and we welcome all ideas that can help prevent overdoses and save lives. This is my heart's work. Those who know me know that this subject is extremely personal to me. In 2016, I lost my best friend Ashley to an overdose, and I know the immense pain that communities across Maryland all feel. But aside from that hurt so many of us have experienced, I can also tell you there's so much to be hopeful for. After Ashley lost her life, I dedicated my career to working on this issue, and I've met and worked alongside so many people who've been touched by this overdose crisis. I've had the joy of working with people who are thriving in recovery, alongside people who have turned their pain into action, working to prevent more stories like Ashley's. I can tell you recovery is possible. Recovery works, and I know through our collective passion and attention to this cause that we can save even more lives. I want to thank all the dedicated individuals working in this area for their shared commitment to helping people. We humbly ask for the partnership of all Marylanders as we continue on this journey together. And it is my distinct honor now to introduce the Deputy Secretary of the Behavioral Health Administration, Alyssa Lord.
Thank you, Special Secretary Keller, and good afternoon. It is an honor and privilege to join you today. My name is Alyssa Lord, and I am the Maryland Department of Health's Deputy Secretary for Behavioral Health. I send regards from Secretary Herrera-Scott, who is unfortunately unable to join us. I would like to thank both Governor Moore and Lieutenant Governor Miller for their unwavering support in ensuring Maryland is building a world-class healthcare system where equity, behavioral health, and substance use is considered as important as the physical health of Marylanders. I'd also like to thank Dr. Gupta for his tireless advocacy and for the implementation of innovative and thoughtful harm reduction, prevention, treatment, and recovery initiatives across the lifespan that have been models for replication. I would be remiss if I also didn't acknowledge the broader work of the White House Office of National Drug Control Policy and the support the state of Maryland continues to receive through the Biden-Harris administration to tackle the opioid crisis. Overdose-related harm affects communities and families in every Maryland jurisdiction. There were 2,583 fatal overdoses in the 12 months ending in July of 2023. Fentanyl was involved in over 81% of these overdoses. While this is the same number of overdoses as the preceding 12 months, this is 2,583 deaths too many. For perspective, this is 2,583 individuals impacted, as well as their loved ones, significant others, parents, children, siblings, friends, neighbors, coworkers. These tragedies ripple outward. In order to uphold the administration's value to leave no one behind, we need to ensure we are building and sustaining a robust network of access and whole person care. Substance use morbidity and mortality is preventable, and access to substance use disorder services can reduce overdose-related harms and save lives. The Department of Health continues to make investments across the continuum of care: prevention, promotion, early intervention, urgent and acute care, and treatment and recovery services. I'd just like to take a minute to highlight some key initiatives across the continuum. The Strengthening Families and Recovery pilot program to support pregnant and parenting women recovering from substance use and opioid disorders, that's $2.7 million over 3 years. Our recovery-friendly workplace pilot collaboration with the Maryland Department of Labor to support employers in cultivating a workplace environment that is inclusive of individuals who identify as being in recovery from a substance use disorder, and that's $438,000 through September of 2024. And under Maryland's commitment to veterans, which aligns with Governor Moore's announcement yesterday to support and empower military families, grants to support members and their families, and that investment is $2.4 million for fiscal year 24. The Department of Health is pleased to continue to partner with the Maryland Office of Overdose Response to promote coordinated statewide action through the aligning of capabilities, data, expertise, and resources to realize the vision of the Moore-Miller administration. Thank you again to Governor Moore, Lieutenant Governor Miller, Special Secretary Keller, and Dr. Gupta for their leadership on this important initiative. I now have the distinct pleasure of passing the baton to Lieutenant Governor Miller.
Good morning, everyone. Good morning. Happy holidays. Deputy Secretary Lord, thank you so very much for your remarks. I'm honored to stand alongside Governor Moore, Secretary Keller, Deputy Secretary Lord, and of course, my friend, Dr. Rahul Gupta, to solidify our strong state and federal partnership and to make Maryland a leader in combating overdose crises. This last fall, I joined Secretary Keller and her team at town halls, engaging with communities in Baltimore City, Montgomery County, and Dorchester County, 3 distinct jurisdictions where the insidious pain caused by substance use remains constant. The communities shared their stories, their pain, and their triumphs, and they shared their feedback with us. They want the overdose crises to be dealt with holistically, one that demands a united front, collective partnership, and where the words we use must be intentional. We know this crisis is rapidly evolving and changing, and if we want to be successful in stopping it, we can't use the tools and the messaging from decades ago. So today, we will be renaming the Interagency Heroin and Opioid Coordinating Council to the Maryland Overdose Response Advisory Council. And we'll be expanding the membership from 7 to 18 different state agencies and offices. I am so proud to work with all of these agencies and to chair this new council. This diversified coalition will work cohesively, sharing crucial data, identifying resource gaps, and collectively addressing overdose trends. Substance use and overdose are directly linked to some of the most pressing challenges facing our communities across the nation, such as childhood poverty, gun violence, and mental health, which is why viewing this crisis through a narrow lens is no longer an option. We have to bring everyone to the table, engaging partners in public health, public safety, and our federal partners, including Dr. Gupta and the Biden administration. But yet, our most powerful allies are community members themselves. Governor Moore and I firmly believe that those closest to the challenge are closest to the solution. It is the people within these communities who understand the nuances, the pain, and it is their perspective that will guide our way forward. We are committed to ensure that our resources reach the communities that are most affected by the crises, individuals living with trauma, those who have been incarcerated, communities of color, veterans, and yes, even our children in our school systems. In embracing an inclusive approach, we commit to healing with empathy and equity. And as Secretary Keller mentioned, she had a personal friend that died from opioid crises. And I can tell you it's touched our family personally as well. I lost my brother-in-law, Ed, in 2017 to opioid overdose. Ed was a really funny individual, and I enjoyed my time with him. His favorite team was the Philadelphia Eagles. As I said, Ed was a funny guy, right? In 2018, the Eagles ended up winning the Super Bowl, and I could not help but think this was Ed's spirit coming down. And I feel it's in my responsibility to make sure that others don't suffer the way in which my brother-in-law did. I never saw it coming. I never knew he was struggling with this, and that's why these stories need to be told as often as possible. And now it's my distinct honor to introduce, from the Biden administration, Dr. Rahul Gupta, the first medical doctor to become the director of the White House Office of National Drug Control Policy. Thank you.
Thank you, Lieutenant Governor Miller. Really appreciate those kind words, and really glad to be joining you, Governor Moore. Glad to be hearing from Secretary Culler as well as Deputy Secretary Lord today. I bring greetings from President Biden and Vice President Harris. Let me say, why am I here today? Well, you heard the 2,583 empty chairs at the dinner table these holidays that are going to be there. They are irreversible. They will not come back. And we're here today because we are working and making sure that we avoid the next 2,583 empty dinner chairs at the next holiday season in Maryland and 110,000 across this country. Now, we know fentanyl, meth, cocaine, emerging threats like xylazine pose a direct and real challenge to communities across the country, including right here to Marylanders. Now, this is personal to President Biden. This is also personal to me. For one, I grew up in Montgomery County. I went to Montgomery County public schools, and it saddens me when I see and hear about overdoses at my high school. The threat now is, at the time was, the drug dealers on the streets that I came across when I was growing up. Today, it's online. It's those fake pills our children are going and ordering, whether they think it's Xanax or they think it's Adderall, but it turns out to be 6 out of 10 of these fake pills have lethal doses of fentanyl. 6 out of 10. That's the odds worse than playing Russian roulette with your life. Now, today, we've had a great conversation about what we need to do more for moving forward. And I can tell you that in Governor Moore and Lieutenant Governor Miller and the team, we see so many historic actions that are happening already from day one of this administration. And we know the actions today will further those efforts to save more Marylanders' lives. You will find a partner in the Biden-Harris administration, a strong partner that is committed to saving the lives and not just surviving, but thriving for Marylanders. Just to give you an example, in 2022, the Biden-Harris administration sent $322 million in drug control funding to Maryland. And in 2023, Maryland is flattening the overdose curve. There cannot be a more direct result of resources, but here's the good thing. Maryland is one of the unique states that puts up its own state dollars, a lot of state money, to match also the federal dollars, to pursue the same objectives of saving lives. And we heard today why and how that is so important. Now, we're doing the same. The White House, we've already put 42% more dollars to states than the entire administration in the last administration. And we have to do more. We have to make sure that we're going after getting people the help they need and going after the trafficking profits. Why? Because, for a simple reason, we cannot treat dead people. Now, the president's strategy goes after two of these drivers, untreated addiction and drug trafficking profits. I can tell you on the first one, we know that the Moore-Miller administration is focused today, we heard, on prevention, treatment, harm reduction, as well as recovery and public safety. Naloxone is now over-the-counter available, and more businesses are becoming recovery-ready. Now, on the second part, just a few weeks ago, President Biden met with President Xi and talked about why it's important for China to get on board to help not only our country, which is the canary in the coal mine, but the entire world. And for that reason, not only is this part of that leadership of President Biden, but we're moving forward to work with China. In fact, I'll be meeting with our U.S. ambassador to China this afternoon to talk about the progress that we've been making. And these efforts, all of these efforts collectively as partners help us, both this administration in Governor Moore, and Lieutenant Governor Miller, but also across the nation. Now, we are making progress. We know nationally, after double-digit rises in overdose deaths, we've flattened the curve in 2022 and 2023. But how do we push forward, double and triple down on the efforts that are working? Well, we do it by working together, because states are not only the laboratories of innovation, but closer to getting to the people to help solve the problems. Let's be clear, this is not a red state or a blue state issue. This is America's issue. And as President Biden often says, that we are the United States of America, and there's nothing, absolutely nothing we can't do it if we do it together. Now, with that, let me introduce our leader. Governor Moore has been leading Maryland forward with record state investments on mental health and substance use from day one. Increasing access to treatment, recovery, having naloxone available, harm reduction has been the key priority. Governor Moore is a real and right leader for the state at the right time. So thank you for having me, and I welcome Governor Moore.
Thank you so much, Dr. Gupta, and welcome back to Maryland. Welcome back to Annapolis, and welcome to the State House. And also, please let the entire administration know, and the President and Vice President, how much we appreciate the continued support. It means the world to us. Good? Also, thankful to be here with our spectacular Lieutenant Governor, and also our Deputy Secretary Lord, and also Special Secretary Keller. And it should not be lost on anybody that as we're up here speaking about these issues, I know it's not just for us, but it's for so many people here and so many people who will watch this later. These issues are personal. It's important, and today is an incredibly important day for our state, also because it's not only hoping for a better future for those we pray never have to get caught up on this, but it's also honoring the legacy of those who did. Today is an important day, and the people behind me, and why I'm so thankful to be with this group here today, is this is a group that has chosen to lead on this issue. This is a group who has chosen to come together on this issue and to bring us together, because your partnership, your intentionality, and your vision is what's going to make us get to a better place in our society. Substance use disorder, it knows no borders. It knows no boundaries. It doesn't know zip codes. It doesn't know socioeconomic restrictions. It finds its way in so many of our communities, and it impacts all of our communities. Substance disorder is not a West Baltimore issue. It's not a West Annapolis issue. It's not a Western Maryland issue. It is not an Eastern Shore issue. It is a challenge that each and every one of us must grapple with and we must defeat. Substance use disorder affects every part of our society, and therefore, it'll take every part of our society to be able to address it. The executive order that I will sign today will help broaden state government's approach to tackling the overdose crisis. And I want to recap what some of my colleagues have already shared. First, today we will be renaming the Opioid Operational Command Center to the Maryland Office for Overdose Response. The opioid epidemic is one of the lead drivers of overdose deaths in Maryland, but it isn't the only driver. We need to look at the issue of overdose broadly, and this name will reflect that philosophy. Second, we will more than double the size of the Maryland Overdose Response Advisory Council. Because when you have more people at the table, when you have more insights and more perspectives, you will come up with better solutions. Third, we will position the Office of Overdose Response within the Maryland Department of Health. The overdose crisis is a public health crisis. I want to say that one more time. The overdose crisis is a public health crisis. And leaders like Special Secretary Keller should have access to the resources of our state health agency, making sure that Secretary Keller and her team have the resources that they need at their disposal. This is an easy decision because it's important that they have what they need to make sure that people understand this can and will be a statewide response. Today's executive order ensures that we have the tools to have a broad approach to addressing overdose in Maryland. And so today, with not just a sense of urgency, but a sense of pride, I'm thinking about all of the Marylanders who will be better served because of this work and because of these executive orders. The Marylanders who want to get better and simply need help. The Marylanders who need the support and are asking for it, but simply want to find a society that's willing to still embrace them. The Marylanders who are currently caught in a public health crisis. I think about them every day and the people who are living with them, supporting them, loving them. And so we're just hoping for the supports that their loved ones can get better. I think about the ones who were taken too soon. I think about people like my friend David Lunn. Where 4 years ago, my friend David Lunn Jr. died of a drug overdose. We had known each other since we were teenagers. He was a third-generation Baltimorean. He literally comes from one of the kindest and most loving families that I know. And I'm looking at Mama Lunn and Daddy Lunn right here in front of me. He was also a fantastic basketball player. I was a good basketball player. He was a fantastic basketball player. In fact, I remember one time during Midnight Madness, when I went up for a dunk and I ended up tearing my knee. And the first person I saw over there laughing at me was David. But when I had to get my knee operated on, the first person I saw when I came out was David. David was remarkable. And he grew up to become a loving father, a youth basketball coach, and an executive at a minority-owned welding company. I tell you this because I think it's easy to focus on how the victims of overdose leave us at the end of their lives, instead of celebrating the lives that they lived, instead of celebrating the fact that they made all of us better. That overdose victims are more than statistics. They're people with hopes and dreams and aspirations and achievements. That was true of David. And that's true of many others. And at David's funeral, David's mom, Mama Lunn, she asked us to tell David's story. She asked us to make the world a better place with his name in mind. She wanted his legacy to live on. She and Daddy Lunn wanted to make sure that we could all work together to help to make sure we were saving Marylanders from the illness that David suffered from. And I've always tried to honor that assignment. We are so thankful to have you both here today and grateful for your consistent love and example. To Mama and Daddy Lunn, to the entire Lunn family, your son was a blessing. And I miss him every day. And today, we will honor his name with this action. When I'm done signing these executive orders, I'd be honored if you guys would join me, because I'm going to give you the pen that I will use to sign this executive order as a way to honor his legacy. This isn't the end of the journey that we're working on together. But today, we collectively are going to make an important step in the right direction. We will step towards action. We will step towards healthier communities. We will step towards saving lives of those that we love. We will step towards making this a better state and making it a state where we truly leave no one behind. So with that, I'd love for my colleagues and also Mama and Daddy Lund to join me around the table as I sign this executive order.
Thank you, everyone. That concludes the event today. Thank you, everyone. Thank you so much.
Thank you.